Have you ever felt your chest tighten a little when you hear two viruses compared in the same sentence? One of my patients once looked at me and quietly asked, "Doctor, is Nipah virus worse than COVID?" I want you to imagine this for a moment. You are sitting at home, the news is on, and familiar words bring back memories you thought you had already laid to rest. I am Dr. Evelyn Carter, and I have spent decades caring for older adults who lived through COVID and are still carrying its emotional weight. For many people, COVID was not just an illness. It was isolation, uncertainty, and fear of the unknown. So when another virus is mentioned alongside it, the body reacts before the mind has time to ask calm questions. That is why we are here today. This conversation is not a warning. It is not a prediction. It is an explanation. Comparing Nipah virus and COVID is not about saying one is coming or one is worse. It is about understanding why health experts talk about them differently and what those differences actually mean for everyday life. Nipah virus and COVID are very different in how often they appear, how they spread, and how public health systems watch them. COVID became familiar because it touched nearly every community. Nipah virus remains rare, but it is carefully monitored because early awareness is part of responsible medicine. Those two truths can exist at the same time. Older adults often tell me that health news feels overwhelming because it moves fast and lacks context. Our minds need time to sort information gently, especially after living through a global crisis. Clear explanations help the nervous system settle. Confusion does the opposite. Here at Senior Health Daily, we slow the conversation down. We place facts inside real-life context. We talk the way we would if we were sitting across from each other at the kitchen table. In the next part, we will begin to gently explore what truly separates Nipah virus from COVID, without fear and without urgency. If this kind of calm and trustworthy guidance helps you feel more at ease, please consider subscribing to Senior Health Daily, liking this video, and sharing it with someone who may need reassurance today. You are not alone in wanting clarity, and I am glad you are here. How Nipah virus and COVID-19 first appeared. When people ask me why these two viruses are often mentioned together, I begin at the beginning, because origins shape everything that follows. I have learned over the years that understanding where an illness comes from can quietly lower anxiety. It replaces mystery with context, and context is calming. COVID first appeared as a cluster of unusual respiratory illnesses that spread quickly from person to person. Within weeks, it was moving through communities, crossing borders, and touching daily life in ways none of us could ignore. I remember sitting with older patients who watched the news every evening, trying to make sense of how something that began far away could arrive so fast at their own doorstep. COVID became familiar not because it was simple, but because it was everywhere. Nipah virus entered the medical conversation very differently. It did not spread through neighborhoods or workplaces. Instead, it appeared in small, contained outbreaks linked to specific environments and animal contact. Many of my patients have never encountered anyone affected by Nipah virus, and that is important to say out loud. Rarity changes how a virus is experienced emotionally, but it does not remove the responsibility of health systems to pay attention. The context of appearance matters because it explains why experts respond in different ways. COVID demanded immediate global action because it moved easily between people. Nipah virus demands careful monitoring because it behaves differently and appears under specific conditions. Neither response is about drama. Both are about responsibility. I often tell older adults that medicine does not only react to what is common, it also watches what is uncommon but serious. That is not a prediction of danger. It is a reflection of preparation. Just as we check smoke detectors even when there is no fire, public health systems observe viruses quietly and consistently. For seniors, especially those who lived through the uncertainty of COVID, comparisons can reopen old worries. That reaction is human. It does not mean something new is happening. It means memory is doing what memory does. By understanding how these viruses first appeared, we begin to separate lived experience from current reality. This conversation is not about ranking fear. It is about understanding difference. COVID became part of everyday life because of how it entered the world. Nipah virus remains part of medical awareness because of where and how it appears. Holding those two truths together allows us to stay informed without feeling threatened, and that balance is the foundation for everything we will explore together. How these viruses spread, one of the most important differences between Nipah virus and COVID, lies in how they move from one person to another. When people understand this clearly, fear often softens because the mind can finally picture what is realistic and what is not. COVID spreads easily through everyday human contact. Breathing the same air in shared spaces, speaking closely, coughing, or spending time indoors together all created opportunities for the virus to pass along. This is why COVID felt unavoidable. It did not require special circumstances. Normal life itself became the pathway. Many older adults I cared for told me it felt as though safety had suddenly vanished from ordinary routines, like grocery shopping or visiting family. That experience left a lasting imprint. Nipah virus behaves very differently. Its transmission is not woven into daily social interaction. Instead, it has been linked to specific exposure pathways, often involving contact with infected animals or contaminated food sources, and only in certain regions. Person-to-person spread has been documented, but it typically occurs in close caregiving settings rather than casual contact. This distinction matters deeply. I often explain to patients that a virus cannot spread widely unless it can move easily between people who are simply living their lives. COVID had that ability. Nipah virus does not spread through routine community interaction in the same way. That single fact explains much of the difference in global impact. This does not mean Nipah virus is ignored. It means it is understood. Public health professionals focus on interrupting known pathways rather than preparing for widespread community transmission. For seniors, this distinction offers reassurance. You are not at risk simply by participating in daily life, going to appointments, or spending time with loved ones. When fear surfaces, it often comes from imagining a threat as closer than it truly is. Clarifying how transmission works restores a sense of proportion. I remind older adults that knowledge is a form of protection, not because it changes the virus, but because it changes how the body responds to information. By comparing how these viruses spread, we begin to see why COVID transforms society, while Nipah virus remains a topic of careful observation rather than daily concern. Understanding this difference allows us to stay aware without becoming anxious, and that calm understanding will continue to guide the rest of our conversation. Symptoms compared without alarm. When people hear the word symptoms, their bodies often tense before their minds can listen. I have seen this many times in my practice. A patient will lean forward and ask quietly, "What should I look for?" Maine. What they are really asking is whether they should be worried. This is why it matters so much how we talk about symptoms, especially when comparing two very different viruses. COVID symptoms became familiar to most of us because they appeared so widely. Fever, cough, shortness of breath, body aches, and fatigue were common topics of conversation for years. Some people lost their sense of taste or smell. Others felt exhausted for weeks. Because COVID affected millions, these symptoms entered everyday language. They became part of shared experience, which is why they still carry emotional weight for many older adults. Nipah virus symptoms are discussed far less often, and that can make them feel more frightening than they need to be. In reality, early symptoms are often described as flu-like. Things such as fever, headache, fatigue, and general discomfort. These signs are not unique and can overlap with many common illnesses. In some cases, symptoms can progress to confusion or changes in alertness, which is why medical teams take Nipah virus seriously when it appears. Still, it is important to remember that these cases occur in specific settings and are not something most people encounter. I often explain this to seniors in very simple terms. COVID symptoms felt personal because many people around us experienced them. Nipah virus symptoms feel unfamiliar because most of us have never seen them firsthand. Unfamiliar does not mean imminent. It means rare. Another key difference is how symptoms are noticed. COVID symptoms often appeared quickly and spread rapidly through households and communities. Nipah virus symptoms tend to be identified through careful medical evaluation in specific regions, often connected to known exposure pathways. This changes the emotional experience of illness. For older adults, the body can react strongly to symptom discussions because memory fills in the gaps. The nervous system remembers the uncertainty of COVID and tries to protect by staying alert. Gentle explanation helps interrupt that cycle. Symptoms are information, not predictions. By comparing symptoms without alarm, we give the mind space to understand instead of react. The goal is not to memorize signs or stay on edge. The goal is to recognize that these viruses behave differently, feel different in daily life, and are handled differently by medical systems. Clarity reduces fear because it restores perspective. When symptoms are placed in context, they become part of understanding rather than a source of anxiety. That calm understanding is exactly what we continue to build together. Why? COVID-19 became familiar. When I ask older adults why COVID still feels close to the surface, even years later, they often say the same thing. It was everywhere, all at once. That familiarity did not come from comfort. It came from repetition, disruption, and shared experience. Understanding why COVID became a global memory helps explain why comparisons with other viruses can feel unsettling. COVID moved through communities with remarkable speed because it traveled with people. Everyday movement became the vehicle. Workplaces, family gatherings, public transportation, and social events all created pathways. The virus did not need special conditions. It needed proximity. This is what turned a medical issue into a lived experience across cultures and generations. Community played a powerful role. People watched neighbors fall ill, supported friends from a distance, and changed routines together. For many seniors, the sudden loss of familiar rhythms was as impactful as the illness itself. Churches closed, family visits paused, and medical appointments shifted. These changes embedded COVID into memory, not just as a virus, but as a chapter of life. Global travel amplified this process. The modern world is deeply connected, and COVID moved along those connections effortlessly. What began in one place reached many others before systems had time to respond. That speed created a sense of helplessness, especially for older adults who depend on stability and predictability to feel safe. Nipah virus did not follow this path. Its appearance has been limited by geography, environment, and specific exposure routes. Without broad community spread, it never entered daily conversation or collective memory. This difference alone explains much of the emotional gap between the two. I often remind patients that familiarity does not equal danger. COVID feels familiar because it touched daily life, not because it was the only serious illness in the world. Likewise, a virus that is less familiar is not automatically more threatening. The human brain fills unfamiliar space with imagination, and imagination can amplify fear. By understanding how community and movement shaped COVID's reach, we can begin to separate emotional memory from present reality. The comparison is not meant to reopen old wounds. It is meant to explain why one virus reshaped society, while another remains a topic for medical vigilance rather than lived experience. Recognizing this difference allows older adults to breathe more easily. It places today's information into a frame that honors what we lived through, while gently reminding us that not every comparison signals a return to that time. Why Nipah virus is monitored differently. When people hear that Nipah virus is closely monitored, they often assume that something urgent must be happening. I understand that reaction, especially among older adults who lived through years of intense COVID coverage. In my experience, the word monitored can sound like a warning siren, even when it is not meant that way. This is why explanation matters. Nipah virus is rare, and that rarity is precisely why it is handled with such care. Public health systems are designed to pay attention not only to what is common, but also to what could become serious if ignored. Nipah virus appears under specific conditions, often tied to certain environments and exposures. Because it does not circulate widely, each case provides important information. Monitoring allows health professionals to learn, prepare, and respond calmly if needed. COVID required a very different response. It spread easily between people and moved rapidly through communities. Public health systems had to shift into emergency mode, focusing on containment, treatment capacity, and communication with the public. The urgency was visible and constant because the risk was immediate and widespread. With Nipah virus, the response is quieter. There are no daily updates because there is no ongoing community spread. Instead, monitoring happens behind the scenes through surveillance systems, research networks, and cooperation between countries. Most people never see this work, and that is actually a sign that it is functioning as intended. I often compare this to routine health screenings. We monitor blood pressure or cholesterol, not because a crisis is happening, but because early awareness keeps small issues from becoming larger ones. Public health works the same way. Attention does not equal alarm. For seniors, understanding this difference can bring relief. You are not expected to change how you live or remain on high alert. The responsibility rests with systems designed to protect communities quietly and consistently. By comparing how public health responds to COVID and Nipah virus, we can see that monitoring is a form of stewardship, not fear. It reflects commitment to preparedness and respect for human life. When this context is clear, information feels less threatening and more supportive. This understanding allows us to stay informed without carrying unnecessary worry. It reinforces the idea that vigilance and panic are not the same, and that calm, steady observation is often the most responsible response of all. As we move through these differences together, I want to pause for just a moment and acknowledge something important. Learning about health can be tiring, especially when it touches memories of uncertainty or times when life felt out of control. Many older adults tell me that even calm information can stir emotions they did not expect. That response is not weakness, it is awareness. Over the years, I have learned that the most meaningful conversations about health are not rushed. They unfold slowly, with room to breathe and reflect. That is exactly what we are doing here. We are not trying to convince you of anything or push you toward worry. We are simply building understanding, one clear step at a time. I often think about the patients who used to sit across from me in the exam room and say, "Thank you for explaining it in a way I can actually follow." Those moments reminded me that clarity is a form of care. When the mind understands, the body can relax. When the body relaxes, decisions feel less heavy. That is the spirit behind Senior Health Daily. This space exists to offer calm guidance in a world where health information often feels loud and urgent. We slow things down so you can absorb what matters and leave behind what does not. I also want to say this directly, because it truly matters to me. I'm Dr. Evelyn Carter from Senior Health Daily. If this video has helped you better understand your health, please consider subscribing, liking, and sharing Senior Health Daily. Your support truly encourages us to continue creating calm, helpful, and trustworthy health content made especially for you. Sharing this video does not just help the channel. It helps another person who may be sitting at home with the same questions you once had. Someone who wants to understand without being frightened. Someone who needs reassurance more than headlines. As we continue, remember that you are not expected to remember every detail. Understanding is not about memorizing facts. It is about feeling grounded enough to listen without tension. Take this information at your own pace. Let it settle where it needs to. We will keep moving forward together with the same steady tone. No urgency, no pressure. Just clear perspective and respect for the life experience you bring into this conversation. Is one more dangerous than the other? This is often the question that sits quietly beneath everything else. Is one more dangerous than the other? I hear it in exam rooms, in phone calls from worried family members, and sometimes in the silence that follows a news headline. To answer it honestly, we need to slow down and talk about what the word danger actually means in medicine. In everyday language, danger sounds absolute. Something either is or it is not. In healthcare, danger is always tied to context. It depends on how a virus spreads, who it affects most often, how quickly it can be detected, and what systems are in place to respond. Without that context, comparisons can easily mislead. COVID was dangerous because of how easily it moved through populations. It reached older adults quickly and often before anyone realized what was happening. Hospitals were overwhelmed not because the virus was mysterious, but because it arrived everywhere at once. For many seniors, the danger felt immediate and personal because it disrupted daily life and access to care. Nipah virus carries a different kind of concern. When it occurs, it can be severe for the individuals affected. That seriousness is why medical professionals pay close attention, but severity does not automatically translate into widespread risk. A condition can be serious without being broadly dangerous to the general population. This distinction is subtle, but it matters. I often explain this by using a simple example. A steep mountain trail can be dangerous to someone hiking without preparation, but it does not threaten everyone living nearby. A busy highway, on the other hand, affects many people simply because they use it daily. COVID behaved more like the highway. Nipah virus behaves more like the trail. Both require respect, but in very different ways. For older adults, this clarification is especially important. After living through COVID, the nervous system learned to associate comparison with alarm. When another virus is mentioned in the same breath, the body reacts before logic has time to step in. That reaction is understandable, but it does not always reflect current risk. Comparisons without context can create unnecessary fear. Comparisons with context create understanding. Medicine relies on the second, not the first. When experts discuss Nipah virus alongside COVID, they are not ranking threats. They are explaining differences in behavior, monitoring, and response. Danger in healthcare is never a single number or label. It is a relationship between a virus and the world it enters. When we keep that perspective, we can listen without panic and learn without feeling threatened. That balance is what allows information to serve us rather than overwhelm us. Risks for older adults. When we talk about risk, especially in older adulthood, it is important to remember that risk is not only about the body. It is also about memory, experience, and emotional history. Many older adults carry the imprint of past health crises, and COVID added a chapter that was both intense and deeply personal. This shapes how new information is received. From a medical perspective, age can influence how the body responds to any illness. The immune system may take longer to react, recovery can require more time, and underlying conditions can complicate what might otherwise be a mild infection. These realities are part of aging, not signs of fragility. Understanding them helps us approach health with respect rather than fear. With COVID, older adults faced higher risk because the virus spread easily and often reached vulnerable individuals before protective measures were in place. That experience taught many seniors to stay alert, sometimes to the point of constant vigilance. While that alertness once served a purpose, it can linger longer than needed. Nipah virus presents a very different situation because it does not circulate widely in communities. Most older adults are not exposed through daily life. The risk is not something you carry with you into the grocery store or a family gathering. Yet the mind may still react as if it were, especially when comparisons are made without explanation. This is where understanding becomes powerful. When seniors learn how and where risks actually exist, anxiety often softens. The body relaxes because it no longer feels surrounded by uncertainty. Knowledge does not remove caution, but it replaces imagined threat with realistic awareness. I have seen this shift many times. A patient arrives tense, worried about every headline. After a calm conversation, their shoulders drop. They realize they are not expected to manage global health concerns on their own. Systems exist to do that work quietly. For older adults, feeling safe often comes from predictability and clarity. When health information is presented slowly and with context, it supports emotional well-being as much as physical health. This is why comparisons must be handled gently. The goal is not to warn, but to inform in a way that honors lived experience. Understanding risk does not mean preparing for the worst. It means recognizing what applies to your life and letting go of what does not. When that balance is reached, worry loses its grip and confidence has room to return. Media headlines versus medical reality. Many older adults tell me they feel overwhelmed not by illness itself, but by the constant stream of health headlines. News moves quickly, and its job is to capture attention. Medicine moves carefully, and its job is to protect people over time. When these two approaches intersect, confusion can easily follow. Headlines are designed to be brief and emotionally engaging. They often highlight uncertainty or contrast because those elements draw the eye. Comparing viruses in a single sentence can sound dramatic, even when the underlying medical discussion is measured and thoughtful. This difference in tone is not always intentional, but it has real effects on how information is received. Medical reality unfolds in a quieter way. Physicians, researchers, and public health professionals look at patterns, data, and context. They ask how often something occurs, under what conditions, and who is most affected. This process takes time and rarely fits neatly into a short headline. As a result, important nuance is often lost when complex information is condensed. For older adults, this gap can trigger anxiety. After living through COVID, many people learn to associate urgent language with personal risk. When new comparisons appear in the media, the nervous system responds as if another crisis is beginning. This reaction is understandable, but it is not always accurate. I often encourage seniors to pause before absorbing health news fully. Ask simple questions. Is this information describing what is happening now? Or explaining why something is being studied? Is it focused on individual risk or on system-level preparation? These small distinctions can change how the body responds to what the mind is reading. Choosing sources that prioritize explanation over excitement can also help. Trusted medical voices tend to speak in complete sentences, not fragments. They acknowledge uncertainty without amplifying fear. Over time, learning to recognize these patterns builds confidence. Comparisons in medicine are tools, not warnings. They help professionals understand differences and plan appropriately. When taken out of context, they can feel alarming. When placed back into context, they become informative. For older adults, receiving information wisely means giving yourself permission to step back. You do not need to react to every headline. Understanding grows best in calm spaces, where facts are allowed to settle rather than compete for attention. That approach supports both mental peace and physical well-being, and it allows medical reality to be heard more clearly than noise. What this comparison really means for you. After walking through these differences together, it is natural to ask what all of this truly means for you and your daily life. Comparisons between viruses can sound heavy, but their purpose is not to place a burden on individuals. Their purpose is to bring clarity where confusion once lived. The most important thing to remember is that understanding replaces fear when it is given time and context. COVID became part of your lived experience because it touched everyday routines, relationships, and memories. Nipah virus exists in a very different space. It is discussed in medical circles because responsible systems pay attention to both what is common and what is uncommon. That awareness does not translate into personal danger for most people. For older adults, this comparison is not asking you to stay alert or change how you live. It is offering reassurance that health professionals think carefully about risk, spread, and impact before sounding any alarm. You are not expected to monitor global health trends on your own. That work is already happening quietly, behind the scenes, by people trained to do it. I often remind patients that comparison is a tool for understanding, not a signal to worry. When doctors compare two conditions, they are trying to explain behavior, not predict outcomes. They want to answer questions calmly, not create new ones. When this intention is clear, the information feels lighter and easier to carry. What truly matters is how you feel in your body after hearing this information. If your shoulders feel less tense and your breathing feels steadier, that is a sign that understanding is doing its job. Knowledge should help you feel grounded, not vigilant. It should support confidence, not caution fatigue. This comparison also highlights something important about resilience. You lived through COVID. You adapted, endured, and found your way through uncertainty. That experience does not mean you must relive those emotions every time a new health topic appears. It means you now have perspective. You know what widespread risk looks like, and you can recognize when a situation is being discussed thoughtfully rather than urgently. What this comparison really offers is permission to trust your ability to listen without panic. It invites you to stay informed while remaining at ease. It reminds you that not every mention of a virus is a warning, and not every comparison is personal. As we move toward closing this conversation, hold on to this simple truth. Understanding is meant to support your well-being. When information is shared with care and context, it becomes something you can hold calmly, without fear and without urgency. Thank you for staying with me until the very end. That choice matters more than you may realize. Listening calmly, without rushing to conclusions, is already an act of care for your own well-being. As we close this conversation, I want to gently remind you of something important. Comparing viruses does not mean that danger is approaching your door. It means that medicine is doing what it is meant to do: observing, learning, and explaining. When comparisons are shared with context and care, they are meant to inform, not alarm. For older adults especially, understanding brings a quiet sense of control. Not control over illness, but control over how information is received. When you understand why experts compare one virus to another, your body no longer has to fill the gaps with fear. The mind settles, breathing slows, perspective returns. Your body has carried you through many seasons of change. It has adapted, recovered, and learned resilience in ways that deserve respect. Patience with your own reactions is part of honoring that journey. There is no need to rush understanding. It unfolds naturally when given space. Senior Health Daily exists for moments just like this, when headlines feel loud, when health news feels confusing, when you simply need a place where information is shared slowly and with compassion. You can always return here to reset, to listen, and to feel steady again. If this conversation helped you feel clearer or more at ease, I warmly invite you to stay connected with us. Subscribe to Senior Health Daily, share this video with someone who may need reassurance, and continue walking this path of understanding with us. Knowledge should leave you feeling supported, not pressured. Calm, not concerned. Confident, not overwhelmed. I'm grateful you spent this time with me, and I look forward to being here with you again whenever you need a steady voice and a quiet place to listen.